Mortality. Data on mortality are considered vital statistics, along with data on fertility and marriage, because these are related to life and influence the size, structure, and growth of populations. Mortality is a key indicator of population health and severity and risk of disease. For example, mortality rates indicate how people are likely to die in infancy from infectious disease or later in life from chronic disease. The crude mortality rate is the actual number of observed deaths from all causes per 1,000 people per year, or sometimes per 100,000 people. The term crude signifies that it is based on raw data. It is calculated using number of deaths in the specified population in the numerator, for example, the total population or male children under 5, and then dividing by population size in the denominator. When calculating for a specific year, the population size at mid-year is used, since populations fluctuate. Crude mortality rates are not that informative except as starting points for calculating adjusted rates. It's not really a rate, but it's rather a cumulative measure of incidence of death. And observed differences may be the result of factors that differ, such as sex or age distributions between populations, so it should not be used to compare populations. At the other end of the lifespan, we have the crude birth rate. This is affected by the number and age composition of women of childbearing age and used to project population changes. It's calculated by using the number of live births within a given period in the numerator and the population size at the middle of that period times 1,000 population. The example of 4,111,000 babies born in the U.S. during 1991, when the U.S. population was 252,688,000, the crude birth rate was then calculated by dividing 4,111,000 divided by 252,688,000 to give a crude birth rate of 16.3 per 1,000. Another rate we often discuss is the infant mortality rate. The death of a baby before his or her first birthday is called infant mortality. The infant mortality rate is the number of infant deaths that occur for every 1,000 live births. This rate is often used as an indicator to measure the health and well-being of a population, because factors affecting the health of entire populations can also impact the mortality rate of infants. In the U.S., for example, there are significant differences in infant mortality by race and ethnicity. The mortality rate for black infants is more than twice that of infants in many areas. It indicates unmet health needs and poor environmental conditions, and is calculated, as you see in this formula, the number of deaths among infants in the first year over the number of live births times 1,000. And since not all infants who die during a calendar year are born in that year, this is usually balanced out by infant deaths born in the current year going into the following year's infant mortality rate. Some other rates that we are sometimes interested in include fertility rate, which is the number of live births divided by the number of fertile women; fetal mortality, which is the number of deaths after 20 weeks gestation, divided by number of live births; maternal mortality rate, which is the number of deaths due to childbirth over the number of live births. And this can provide a lot of information on access to healthcare and socioeconomic status factors. And not all crude rates are infant or birth related, of course. There are other mortality measures that we're interested in, such as the case fatality rate, which case fatality rates indicate what percentage of people diagnosed as having a certain disease die within a certain time after diagnosis. This differs from the mortality rate in that the denominator includes only people with the disease. Proportionate mortality is not a rate, but indicates the proportion of deaths caused by a particular disease. And then years of potential life lost. In order to calculate this, there are two steps. First, each deceased person's age at death is subtracted from a standard age, which varies by population. And if an infant, for example, dies at age 1 and the standard age is 65, then the infant has lost 64 years of life. Then all YPLL for all individuals, for all causes, are added together to obtain the total years of potential life lost for a population. It's very critical to know what assumptions have been made, especially about what constitutes the standard in a particular population. Here's an example of case fatality ratio, a measure of disease severity. The question we ask is, how likely am I to die of this disease once I've been diagnosed with it? An example is between June and November of 1976, the Ebola virus infected 284 people in Sudan. 117 died, and the case fatality ratio, therefore, was 117 over 284, or 42%. Another example of measles outbreak in Niger, you had 92 deaths out of 948 cases. This gave a case fatality rate, 92 divided by 948, of 9.7%. However, note that the case fatality rate was 15.6% in infants aged less than 1 year. So the case fatality ratio may vary depending on subpopulation. The proportionate mortality ratio is a disease-specific measure. It is calculated by taking the mortality from a specific cause during a time period, dividing by the mortality from all causes during the time period, and multiplying by 100. For example, the proportionate mortality ratio for HIV among 25 to 44-year-olds could be calculated as 22,795 divided by 148,904, that's the mortality from all causes during that time period, to give a proportionate mortality ratio of 15.3%. This is not a measure of the risk of dying of a particular cause. The relative importance of a specific cause of a disease in relation to all causes of death in a population is what is shown by the proportionate mortality ratio. In this table, you can see the number, proportionate mortality, and ranking of deaths for leading causes of death, all ages, and for the 25 to 44-year age group in the United States. You can see that the proportionate mortality for HIV was 0.5% among all age groups and 5.3% among those aged 25 to 44. In other words, HIV infection accounted for 0.5% of all deaths, of all people, but 5.3% of deaths among 25 to 44-year-olds. Specific rates are used for comparisons between populations or a single population at different time periods. We consider cause-specific rates as well as age-specific rates, basically rates in any subgroup of a population. And this can avoid influence of factors which may be differentially distributed in populations. So let's look at cause or disease-specific rates, where you take the mortality or frequency of a given disease over the population size at midpoint of the time period times 100,000. We could calculate this for, say, cancer or heart disease. Some limitations of this approach include that it can be difficult to identify the cause of death, as people often experience multiple causes, for example, smoking, diabetes, and heart disease. The denominator may also have some limitations, missing certain segments of the population, for example. Age-specific rates. The age distribution of a population is the single most important characteristic influencing mortality. Thus, we are often interested in looking at specific age groups, for example, deaths among those aged 5 to 14 years old. And that would be divided, if we're looking at age-specific rates, by all people, the number of people who are 5 to 14 years old, and multiplying by 100,000. In the U.S. during 2008, we had 1,106 cancer deaths among 5 to 14-year-olds, and there were 35,904,000 people in that age group. Thus, the age-specific cancer death rate in 5 to 14-year-olds was 1,106 divided by 35,904,000 to give a rate of 3.1 per 100,000. Next, you can spend some time working through examples with the assignment.